Hello guys, my name is David, more popularly known as DB the Love Doctor, and today is a date with the Love Doctor where we talk about life, we talk about money, we talk about love. And today, before I introduce my guest today on set, I want to talk about our sponsor. His name is, or the company name is Flenzino Homes and Interiors. They deal on chairs, they deal on interiors, decorations. If you want your house to look beautiful, trust me, it's the right company to call. So today I have on set my guest all the way from Abuja to Port Harcourt, Dr. Felix Twendo. Welcome, sir.
Pleasure.
Wow, you look very awesome, sir.
Thank you so much.
Then I used to see your picture, on Facebook with the suits. Thank you very much for being on set with us. So today we're going to be going straight, back to back with our topic for today. You know how we do it now. It's all about love. So let's talk about love. Let's talk about cosmetic surgery this time. If you could check the publicity, it stated there are complications of the buttocks, breast, and penis enlargement. Yes, we are going to talk about it. Some people have been misguided, but let's have a doctor talk about this. So, Dr. Felix, can you kindly tell us what plastic surgery really means? About it. Just give us a glimpse about it so that our audience, understand what we are dealing with today.
Okay, nice to have you here, guys. Plastic surgery, as it says, is a big word.
Okay.
Another word for plastic surgery is cosmetic surgery.
Okay.
So, in cosmetic surgery, you want to make fine what you think is not fine.
Mm-hmm.
You want to make acceptable what the general population or people feel is not acceptable.
Okay.
But even at that, there are some of these plastic surgeries that are recommended by doctors.
Okay.
Why some are not recommended by doctors, but they are fashionable. So let me just go straight to today's topic. So one of those fashionable cosmetic surgeries we have to do is breast enlargement, hip enlargement, buttocks enlargement, penis enlargement.
Okay.
So there are cases where we doctors ask for people to go for breast enlargement and penis enlargement. There are cases.
Okay.
I'll just mention some of those cases. For example, when a man is having what we call like a micro penis, what you have what we call buried penis.
Okay.
Buried penis is when you have a penis that is almost into the scrotum or in between the thighs or just below the pubic symphysis. The fat is covering it up. Surgeries can help in such cases, especially when the partner is complaining about the sexual activity of the other man and all that.
Okay.
While for breast also, in some cases, we also encourage that. But in majority of the cases we see today, most of the people that go for these surgeries are not those who need them. They're just doing it for fashion's sake, for what is trending and what is reigning. So generally, this is what cosmetic surgery or plastic surgery is all about.
Wow. Thank you very much.
You're welcome.
So about this plastic surgery, I wanted to say something abstract from this stuff, but I just remember that my own is okay. My own is okay.
Well, it depends on what you know is okay.
No, my own is okay. I like it the way it is.
It's fine.
Okay, let's talk about the breast enlargement. Okay. In such cases, what are the effects? What are the complications of such surgery on the breast? For those people, you said that they are okay, but they don't feel okay. They want to just do it for beauty's sake.
Well, whether for those who feel they need it or those who do not need it, or those you recommend or those you don't recommend. Medicine is medicine. So when you're speaking about one, you're speaking about everybody.
Okay.
So surgeries, these surgeries can get complicated at the point. One of the things that can happen is sometimes you can have leakages. What you insert into the breast, whether breast, buttocks, or penis, what you insert into them is what we call a titanium material,
Okay.
or you have to use an inert material. When you read chemistry, inert means it can't react to the body.
Okay.
Some use silicon, silicon most times, and then there's a new one that has been developed recently. They put normal saline in a bag. Normal saline is like what you have in your drip, what you call your drip, or your salt solution. They put it in a kind of bag, and that bag should not be something that can leak out. Then they insert it there to make the breast look rounded, or the shape of whatever you want to put it into. So when they want to do this, they separate the fat part of the breast, fix it inside, and then cover it up again with the fat. So making sure that the nipples are aligned and all that. But in this case, sometimes you can have a case where such material that you put inside can leak off, and then there will be a resurgery. In terms of that, you can start having contraction. Contraction is when you begin to have lines of healing all over. So you see kind of incisions, contractions. I don't know if you've seen men who barb and have all these scars here. You begin to have something like that all over the breast. Then you have what we call hematoma. Blood can clot somewhere and stay there. You have what we call seroma. You can have fluid collection staying under somewhere. You can have what we call reinfection. Because the place is leaky and open, you see materials like air, water flowing into that area, and reinfection. Reinfection can occur. Then sometimes in some other cases, these infections can spread wide and getting into the mediastinum and other places, causing pain, causing bleeding, causing discomfort. So these are some of the side effects.
Sorry to ask, can it also result to cancer?
Definitely. You see, one of the major problems we have in the country today is that cancer does not have a major cause. When you say, for example, smoking causes, cigarette smoking causes lung cancer. You cooking with firewood
and can also cause
this sun can cause cancer. Anything can cause cancer. So cancer just means, a simple definition of cancer means the good cells in the body have turned bad. Then the bad ones begin to eat up the good ones. So when you enact something like that and it transmogrifies, changes or transmutates, the next thing is it can become cancerous. And begin to eat up the body.
Wow, that's very nice. For this first one, I really enjoyed the way you placed it. Yes, that is very nice. So let's talk about the buttocks enlargement or the hips enlargement. What do you have to say about that one?
In cases of buttocks enlargements, it even has more contraction because you are dealing with an area that is full of muscles. When you see a woman with a big buttocks, or you see a guy with a flat buttocks and all that, what is making it huge or flat is because of the amount of muscles we have. That we call it gluteus maximus. We have gluteus minimus and all that. Then for those that have the big sized one, what is actually making it look so big is because of the fat content that is there. So by the time you insert all these inert materials there to enlarge and all that, your sitting pattern will change. You don't go back and start sitting, doing exercises anyhow. You have to wait for a while. So just like the breast also, but this is worse because you have more activities on the buttocks than in the breast. The breast is just under gravity. Why this one, you sit on it, you walk on it, you do a lot of things to contract the buttocks. So the complications here are more than that one on the breast. So sometimes you can have, you can have infection again. You can have contractions again. You can have scars everywhere, because when the doctor wants to visit again to correct and recorrect, you begin to have scars of all kinds. Then sometimes because the muscle is just, muscle is strong. It's trapped. So you have the material inwards and the muscle is trying to contract with themselves. You are seeing the muscle causing a kind of, should I call it hypertonicity. So the person is not comfortable. That's why you find most of the celebrities who do some of these things, every now and then, the thing is looking here and there because they keep going back to, recorrect the surgery.
So you're actually saying that this can also go wrong, like after making the plastic surgery, it can also go wrong in the process.
Even when doctors do the normal surgery, you can't say it's 100%, it's going to be right and all that. It can go wrong. How much more when somebody is doing cosmetic surgery?
But some will feel it's forever after doing the cosmetic surgery.
No cosmetic surgery goes forever. Cosmetic surgeries, whether you're doing it on the teeth, on the eye, on any part of the body, even those who wear tattoos, most times you go back to renew. Because if not, it won't glow. The skin has epithelial cells that die and renew and die. That's why we wash every day. Even after washing the bathroom, you come to clean with a neat towel, it still looks black. So this surface is always dying. So there's no way the cosmetic surgery will remain forever. sometimes 10 years, sometimes 20 years, sometimes 5 years. It goes down, you come back again.
Wow, 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 wow. I really appreciate that. So let's talk about the last on our list now, which is the penis enlargement.
Yeah.
So for some guys, they do have this complaint that I don't satisfy my spouse so much, so I want to enlarge my penis and all that. Some of them are okay. I won't say some of them, they just want to impress. You understand? Some people have that mindset of I want to impress her. I want her to know that I'm the king, I'm the baba. You understand? So I want you to tell us what are the complications of this or the side effects for having penis enlargement for the guys.
When patients come to me or clients, it's better used as clients than because it's cosmetics, and they tell me, doctor, I have a small penis. The first question I throw at them is, what is the size of a normal penis? And they begin to stare at me. So there are ranges actually, and you don't say somebody has a small penis until a certain thing is done to know whatever size it is and all. So, like you said earlier, most people who say they have small penis don't really have small penis.
They don't.
It's just the youthful exuberance. What they watch online and all that. Most things they watch online are fake things.
That's right.
These things that people that put cucumber in their boxers and all that and make it look like it's real. Anyway, however, that is, like I said also in the beginning of this show, there are people that really have what we call small penis, micro penis. Some are born that way, and then some because of accidents or because of some medications they've been on, that reduce the size of the penis and all that. Then there are some that have what we call buried penis. That one is an eyesore, it's not good at all. Where even the scrotum, the bag, is almost bigger than the penis, and the penis is looking like this, my thumb. In such cases, you recommend that they go for a surgery. Now, look at what happens. Whether the breasts, whether the penis, whether the buttocks, all these things have what we call nerve cells. So the more you insert these silicone materials to make it bigger and all that, you are kind of elongating these nerve cells. And then what are you doing? You are reducing their sensitivity. So one of the side effects of penis enlargement is you become desensitized. Your sensitivity of somebody touching you, that somebody touched me, becomes reduced. So even that
because you're stretching the nerves.
Satisfaction you are looking for will go down, because what is doing the work is not your real muscle, it's not natural muscle. There are fake things you put inside, so they can't be like the natural. So that's one of the things. Another thing you can add is what we call a bent penis. Because the muscle is straight, but you've stretched it and then put something inside. So it will not start getting curved, kind of, and that also will send signals to the nerves. They won't be able to conduct fine. 3, infections can come in. 4, it can fail. And when it's failing, you go for another surgery. The elongation you are now looking for will be shortened again because they have to cut off some parts and all that. Another thing is you can have men who have very big tummy, covering their penis and all that. They take some fat from that and try to introduce into the penis. They take some fat from what we call the suprapubic region and try to introduce into the penis. Doing all this part, when you are taking out those fats are meant to insulate. They also have their own function. So when you remove those fats, the person begins to have thermal issues. Because what is supposed to be insulated is no longer there. So issues here and there.
Wow.
So what you do in this case is you weigh the options of the complications and what you want to achieve, and know whether it is right to go for it or to back up.
Oh wow, it's so amazing getting this from you. Actually, I feel so touched because me, I know my own is okay, but some of my friends
I
know my own is okay now. Dr. Felix, how do you think my own is okay?
Well, like I said, you don't know what.
Yeah, I know. I am very sure. No, I am very sure. My doctor doesn't need to see this one.
Let me quickly mention something.
Okay.
Also. When we say cosmetic surgery, it is not only through surgery that you achieve enlargement. Some use cream, some use medications. That's why you see in our routine environment, you see a lot of people come to the television, radio, or even in the local vehicle, or commercial vehicle. Hey, are you having weak erection? Are you having small something? Come and buy. Before you know it, people are buying. They don't even know the combination of the drug. They don't know the constituents. They don't the drugs. Most times don't have that number. They don't know the side effect. They just consume everything. And most of these things do more harm than good.
Wow. So, in essence, we're saying that cosmetic surgery, it's not really
If you must do a cosmetic surgery, let the doctor
prescribe or
see what you want to
Okay.
go for and tell you it is okay, you go for it, or I don't think this is necessary.
Okay.
There are some surgeries we stop and say we don't think it's necessary, go on
Okay.
this or go on that. And there are some we encourage and say go and do this.
Okay.
It will improve your life.
Wow. Thank you very much, sir.
You're welcome.
I want to really appreciate. And for those of you who are watching this, this is a date with the Love Doctor where we talk about love, we talk about life. And my name is David Imo, popularly known as DB the Love Doctor. Very important. And my guest here, his name is Dr. Felix Tuendo, all the way from Abuja, just to be here with us. Thank you very much. Peace
Pleasure.
out.
Pleasure.
Thank you. Thank you very much, sir.